It wages little battles within our bodies to protect us each and every moment, and sometimes those battles become a war to keep us alive, and sometimes it turns those attacks against ourselves. The immune system is engaged as the doctors are on call tonight. Funding for On-Call television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call, starting its 11th year of opening doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Dakota Care, the Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Dermatology, the South Dakota American College of Physicians, Aberdeen Asthma and Allergy, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.
Hello and welcome to On Call Television. Dr. Holm is attending the American College of Physician meetings in the western part of our state, and he'll be back next week. I'm Dr. James McGrann with Dakota Dermatology, and I'll be your host tonight. Tonight we're going to be talking about the immune system, how wonderful it is when it works, and how terrible it is when it does not. For most of us, the immune system never sleeps. It's a constant guard to protect us from illness or infection. The immune system is a network of cells, tissues, and organs that work together to defend the body against the attacks by foreign invaders. These are primarily microbes, tiny organisms such as bacteria, viruses, parasites, and fungi that can cause infection. The human body works and provides an ideal environment for many microbes. It is the immune system's job to keep them out, or failing that, to seek out and destroy them. We're fortunate to have a special guest whose own experience has led him to his practice. Dr. Tom Luzier is certified in the American Board of Allergy and Immunology to care for adults and children with asthma and allergies. A trained pediatrician, his medical degree is from the University of Kansas School of Medicine, with a residency at Fitzsimmons Army Medical Center and an allergy and immunology fellowship at University of Kansas School of Medicine. He practices in Aberdeen at the Asthma and Allergy Center. Tom, welcome to us.
Well, thank
Good
you
to
very
see
much,
you.
Jim. Thanks.
We're about to look forward to your questions about the immune system tonight. They're the fuel that keeps us running each night. Call in your questions or comments to 1-888-376-6225. You can also reach us by visiting oncalltelevision.com and clicking on the link there. Well, Tom, great to have you here tonight.
It's great to be here, and this is Rick has given us a very broad category to jump out and try to condense it into 15 minutes.
Well, basically, we're going to try and maintain the best level of quality, and that's a balancing act. It may be finding time in your busy schedule to exercise, or as you should, or it may be something that requires more thought, such as deciding to take a drug to combat one medical problem, even though it causes another, and it may be life-altering as the one you're fighting.
I had sores in my mouth and throat so that I couldn't really eat anymore, couldn't swallow. I couldn't brush my teeth. I couldn't stand toothpaste in my mouth. It was miserable. And we went to Rochester, and they took blood tests and biopsy of my mouth. And along in the afternoon, they told me what I had, that I had Pemphigoid, And later, from there, I was sent to the U of M in Minneapolis and to a Dr. Holland who had studied this Pemphigoid disease, and he took tests and put me on Cytoxin. And we went back to Minneapolis once a week to get tests on this. He cut down on the Cytoxin, and it was improving and improving, so when it got to a point where he said, you can take 1 tablet a day now, as long as you live. And I said, what if I don't? What if I don't? You'll die, he said. Well, I get cancer, skin cancer, and I'm doctoring for that now, but at least I can eat. It's not affecting my mouth inside. I have had several, Dr. McGrann has done several surgeries on my face, mostly on my face. He wants me to discontinue it, and he tried it. And inside of a week, I had a sore mouth again. So Dr. Holmes put me back on it. But I can live with that as long as I can eat. And as soon as I'm off from that, I start getting sores along my teeth and on my tongue and in my throat.
You may not have questions about pemphigus, but if you're itching, sneezing, or wheezing, there may be things you do want to know about. Please call us tonight with questions. Call us at 1-888-376-6225. You can also submit them on the oncalltelevision.com. Tom, with allergy and immunology, it's got to be a constant changing field and always challenging.
It's an extremely challenging area, and we've really expanded. When I first started, the Journal of Immunology, the thing that we read, was about a 2-pound journal, and now it's like a 200-pound journal. So all of us that are physicians and nurse practitioners all deal every day with our immune system. Our immune system's the biggest part of what we do as doctors. Either it's doing too much or it's doing too little. And we have strategies to make it better. Like the patient that we just saw there, we gave them immune suppression because we felt that was the best way to control this process of pemphigoid. When you're an allergic person, that really is your system that takes care of parasites, mistaking pollen and dust mite and things like that as a parasite and ending up being dysfunctional. Now, oddly enough, we use a type of therapy that is not immune suppressive. We actually give you tiny bits of what you're allergic to, and that gives you immune tolerance. So a different concept than immune suppression. Oddly enough, in my practice, probably the most common thing I'm asked is, Doctor, how can I make my immune system work better? Why am I getting sick so often?
What vitamin should I take? What pill should I take? What can I eat something different? It's always, is there something I can take orally that will make me healthier?
Yeah, give me a pill.
Yeah.
Well, unfortunately, it doesn't work that way. So I have to go through my usual spiel, if you will. I always tell them that if you don't want to get sick, you wash your hands. And you know, when you're in Walmart and you're holding on to that cart, they've actually studied those carts. That's a very frightening thing to see what's on those carts, since a lot of babies have been in those carts with diapers, if you know what I mean. So hand washing and using disinfectant is a very effective way to keep from getting ill. Barriers are a good way to do that. You know, when you go out and work in the garden, it's a good idea to wear gloves so that you're not compromising that skin barrier and allowing the skin bacteria to get in. Good dental care. I mean, all the time I have patients come in who have hives. One of the common causes of hives is not taking care of your teeth. And because you're constantly chewing, particularly things like chips and things that kind of poke little holes in there, you're going to end up having the opportunity for those bugs to get in there if you're not taking care of them. You know, we talk about smoking all the time, and smoking wipes out the upper airway, the normal little ciliated epithelium that protect us so much. It's another barrier like the skin barrier. when you're smoking, it paralyzes those cells, so nothing's moving, just like a stagnant pond. So I have to give the smoking the spiel about if you quit smoking, you probably will quit having upper airway infections. We always talk about exercise. A lot of studies have shown that exercise enhances the good part of your immune system. And this has been seen a lot in cancer patients who are exercising and eating right and having a more consistent remission than those who elect not to do that.
Kind of jumping back, could you explain a little bit about what the cilium are in the respiratory tract?
Sure. Inside your respiratory tree, you make mucus. And in that mucus, the body puts the body's form of antibiotic. And it is salts and a thing called ferritin, and it's very effective against bacteria, virus, fungus, and protozoa. So all these things that invade our body are the mucus is amazing stuff. It's half flypaper and half something that the cilia can move on. So this flypaper stuff is moving to the back of your throat, you know, and making the loogies that we talk about. But that catches all that bacteria, pollen, dust, and moves it to the back throat. You swallow it and put it into your acidic stomach, where, just like the science lab, that acid destroys most of those bacteria, virus, as it should. If you compromise any of that, then that organ has to use other defenses, ones that are internal rather than those surface ones. And so smoking knocks out the cilia, paralyzes it, then you start getting chronic mucus production because it's irritating, and you kind of get that chronic cough and mucus production and bacteria that you see with smoking, or even jobs that have a lot of smoke and irritation, like farming.
Yeah, it's kind of interesting. We see not quite that as an intricate system, but we find that, you know, the skin is an immune organ that has enormous function, but the barrier part of the skin is actually a little layer of dead skin and oils. And one of the real issues is that, sort of contraindicated for what you're doing, is we find that if a person overwashes, uses too harsh a cleanser, uses things like that, you destroy that barrier. So there's always a happy medium in there. And so one of the things we're talking about is go ahead and wash, do that thing, keep the skin clean, keep the bacteria levels down, but then hydrate, get the skin moist, and then put a barrier back, because if it's too strong, you're going to strip away that barrier function. And so then we're always coming back and say, okay, we do want you to wash, we do want you to be clean, but when you get done, put on that moisturizer.
That's a very good point. We cross a lot with a process called atopic dermatitis or eczema, and that is absolutely key, is to put the moisture back. It's the dryness and the soap that actually gives you much more of a problem.
You know, one of the things that people have talked about recently, and it's been in the press quite a bit, is the children who are raised in a sterile environment where mom doesn't expose them to germs, microbes, anything like that. And the suggestion is those kids are going to grow up atopic. Can you give us your thoughts on that?
Well, it's called the hygiene theory, and it's a fascinating theory, and it does have a lot of support. That is that children that are raised in an environment where they're not getting much exposure to bacteria have a higher rate of allergic disease. That's the thing they've looked at. So they looked at the kids in Germany that literally live in their barn, and they're in their car seat, and they're inhaling all of the particles associated mostly with cattle and animals. And what they've shown is that the bacteria associated with cow manure, called Bacillus subtilis, it actually enhances a part of your immune system that we enhance with immunizations. It enhances that to such an extent that it suppresses the allergic disease. Now, the interesting thing is the disease of chickenpox does a lot better job of stimulating that part of your immune system called Th1, and suppresses the allergic side much better than our immunization against chickenpox. So it's interesting that we see that. Also, we've seen that people who own dogs have less allergic disease than those that are in an environment that do not have canine stimulation. So it appears that cows and dogs are good for us.
We've got a couple questions here, and we're going to jump into those. And You know, if you've got questions, it doesn't have to be exactly on this line. So if you've got a question, give us a call, 1-888-376-6225, or email us at oncalltelevision.com. Our first question is, what medication can help the immune system? Well, this is kind of, we jumped in a little bit with this, but I guess the answer is there isn't a pill, but we had talked a little earlier, and you mentioned that diet does play a role.
Huge role. And you know, the typical diet that we hear the doctors talk about all the time is extremely good for your immune system. That is the leafy vegetables, kale, less meat, less sugar, all of those features in a diet that we talk about with weight loss, ideal weight, all of those kinds of things make a big difference with your immune system. So there isn't a single pill. Probiotic is recommended. That's the called Bifidobacterium, which is in Activia. Bifidobacterium is a preferential bacteria in your GI tract, and it and we don't know exactly how it functions, because you have to remember that we have more bacteria in our GI tract than we have cells in our body. So there's a real relationship there. But it appears that people who have Bifidobacterium have a little less of the GI issues of that we see with inflammatory disease of the bowel and that kind of thing. So probiotic is a pill.
Well, and you know, I guess we should kind of add in that, you know, people sometimes think, well, if we eliminate all bacteria, the world would be better. But there's good bacteria and there's not good bacteria, and so we're really looking at it as a balance. You know, and
we're doing a lot better with antibiotic stewardship, meaning we're not using as much, and I think that's going to make a big difference on the general disease process, because I think we wipe out the good bacteria, leave the not good bacteria to damage the GI tract, and then that allows things to get in that shouldn't, and that gets systemic and gets our immune system fired up and ends up with a lot of these processes that we see as physicians that are associated with our immune system in dysfunction.
Another question they've asked us is, what's the importance of vaccines in the regular population to protect the old, the young, and those with compromised immune systems? You know, we always get this issue about, well, if my child gets this shot, they're going to be have ADD, or they're going to have some dysfunction, or they're going to be autistic. What's your thoughts on that?
Well, I'm a person that highly favors vaccination, so I want to express my bias is that it is made a huge difference in the number of deaths in children, congenital abnormalities in children. The young people today have never seen these diseases and never seen how devastating the disease is to take a perfectly healthy person and cause an issue which permanently disables them. We talk a lot about West Nile, and there's 4 cases and 5 cases, but when I was growing up, rubella and polio was thousands of cases. So immunization is essential, and it does help our immune system recognize something early so that it can combat it when it comes in. So I'm highly favor vaccination.
You know, I see a lot of elderly people that kind of think, I'm old, I don't need those shots anymore. And so one of the things they come to me and they say, what do you think about the shingles vaccine? And I think that's a critical issue. I tell people, you're 60, you need it. Well, now it's moved down to 50. And it's one of those shots that you can go to your doctor, get the prescription, you go to the pharmacy, the pharmacist gives it to you. As a dermatologist, I see shingles, and it can be a life-devastating disease. You know, there's also Diplococcal pneumonia, and so I always tell people, you know, when you go to your doctor, make sure that you let them know about what shots you're up to or not up to, so they can keep those things on board for you, because it really does, as you said, it reduces disease.
If you've seen a person who's 68 to 70 with pertussis, you know, it's great when you're a kid because you can kind of tolerate it. We used to go to the movie and they'd be whooping in the movie, but that is not a process that you want when you're 65 years old or 68 years old. So I highly recommend people getting their pertussis vaccine, even if they had the disease. Now, some of us are going to carry our pertussis immunity, but for the most part, not.
One of the other things is that you know, in the past when we grew up, we were always worried about smallpox. And that's sort of a thing that's gone away, and chickenpox, and so there are vaccines for those. And of course, smallpox we don't routinely vaccinate for, but chickenpox is one of those things where a lot of people will say, well, why should I get the shot? My child will get the benign chickenpox, and then I don't have to worry about it again. But you and I both know that chickenpox isn't always benign.
Especially when we take care of eczema.
Yeah, so we get that.
That is a very scary disease.
We've got a question here. I have a rash on my back, chest, and arms that get raw and bleeds. Well, what can that be? Well, a rash on the back and chest can be any number of things. It can be just dry skin that's irritated, that's being scratched. It can be allergic phenomenon, something that you put on your skin. It can be related to a medicine you take orally. And in this case, you indicated that it's pretty well gone, but now the skin is brown. And one of the things that happens with the skin is when the skin is injured, it sometimes will dump some of the pigment cells there when it's injured. And so that's called post-inflammatory hyperpigmentation. And it is a condition that will resolve on its own. But if you're seeing a lot of redness, a lot of scale, a lot of irritation, then it's a good idea to have your doctor take a peek, because there are things you can do to help with that. Let's jump over to another question. Let's see, what do we have here? Autoimmune. Why don't we have immunizations to prevent autoimmune disease? So I guess that'd be a good question.
Whoa,
you know,
can
we give a brief down to earth, what is an autoimmune disease?
Well, an autoimmune disease is when your immune system fails to recognize your own cells and therefore leads an attack on those cells. And your immune system has a general immunity and it has specific immunity. So you can have immunity just against your thyroid, or you can have immunity just against your DNA. So depending upon which immune process is going on depends a little bit about how ill you are. And all of us as specialists deal with diseases of the immune system that are, quote, autoimmune.
Yeah.
And of course, in your practice, the skin is a window of these diseases, and so it is a lot of times the first place they present is with the skin.
When we're looking at these, a lot of times people come to me and say, you know, I have this condition, and I try and explain that, you know, the immune system is sort of like a yin and yang. There's a part that attacks the cancers, and then there's a part that helps us protect against these autoimmune diseases. And a very simplistic way I often explain, like with our first case with the Pemphigoid patient, is that sometimes that immune system gets a little out of balance, and the helper cells that are there to protect you are not working as well, whereas the other end of it, the attacking cells are a little more aggressive, and the body starts to recognize itself. So very simplistic way of doing it, but the idea of saying we can immunize to prevent that is sort of an oxymoron, because you have the immune system, it's simply being stimulated in the wrong ways. And so that's the frustration with these. Let's talk a little bit about atopics. You know, as we think about an atopic, I see atopics as individuals with skin rashes. You see them with asthma and hay fever or allergic rhinitis. And then we both share the wonderful disease called hives. And so these are what we call the atopic condition. Would you like to jump in and give us a little summary on what you think with that?
Well, in regards to atopic dermatitis, you and I cross because at times this has a basis in the immune process using one called IgE, which is primarily the allergic protein. And the IgE is a lot of times elevated. But there's a disconnect because, you know, on your side of the equation, they're sometimes missing a protein that's associated with keeping the moisture into your skin, so it dries out. It becomes everything that's outside is available to invade that area. It also ends up in that whole scratch and itch cycle. And so sometimes the patient that comes to me for atopic dermatitis wants to be evaluated for an allergy. They might be allergic and it may be running along, but that isn't why they have atopic dermatitis.
Sure.
They just happen to kind of run together, if you will. And so I'd say about 25% of the atopics actually have an allergic primary source. Sometimes they'll have a trigger that's allergic, like in children, eggs are very sensitizing. So it might be a trigger, but it's really not the major part of that disease. Most of it is that water loss that you just talked about. That's where it's much more important.
You know, as we go back, I kind of threw the term atopic out there. You know, if you're obviously not a doctor, that's a little confusing. Well, we see this population of people that seem to be prone to certain conditions. They've inherited a tendency to get eczema, and sometimes asthma, hay fever, and as Tom was just explaining, they aren't necessarily inherited as one condition, but they often run together. But these are conditions that are usually heritable, and we usually will come and see these people. And in the case with atopic dermatitis, this is the young child that has a rash on the elbows, on the knees. They frequently growing bacteria or staph on the surface, and that's an antigen. And so that's what we see as the atopic disease. And then as they get older, frequently they outgrow the atopic disease, but in many cases at age 12 or 14, we start to see them as early allergic rhinitis or asthma. And it's not that one disease has caused the other, it's that they seem to be inherited side by side. And we're learning a little more about that. But
yeah, that's that whole balance thing you were talking about before, this Th1. The Ts are cells that are, the T cell is kind of the orchestrator, the orchestra master of orchestrating all of this that's going on in our immune system. And there's actually 3 or 4 different types of T cells, and the balance between the 1s and the 2s, and now there's 3s and 4s and a lot of others, but basically the 1s and 2s, is how you keep from being allergic and still maintain the ability to take care of microbes and protozoa and that kind of thing. Yep.
You know, we can go on to any direction you'd like to hear from us. So if you have questions, give us a call at 1-888-376-6225, or you may submit them online to oncalltelevision.com. When we see something like the pemphigus patient, one of the dilemmas that we talk about and why people say, well, why do we want to treat immune diseases, is the issue with this lovely lady, and that she had one disease that we treat to suppress the bullet blisters and not have her die of that, but because we're treating that, we've also suppressed the immune system, so now she's prone to skin cancers. And one of the frustrations of medicine is sometimes we have to do something not so good for one part to help the other part. And so, like in this case with this lovely lady, I'm the sinner on one hand and I'm trying to be the savior on the other, and there isn't a right answer sometimes. And I think that's a frustration, is that how do we work with these patients? And you know, one of the things we were seeing now is that as dermatologists, we're encouraged not to use antibiotics so much, and yet with people with acne, antibiotics clearly help them clear up things, but when we give them the antibiotics, we're changing that bowel flora. We're creating other problems with their immune system. And so it's an interesting phenomenon we're learning to deal with, but at this point, no simple answers. Are there issues you run into with the allergy where you're having that kind of a paradox?
I think we have, we're always the sinner and the savior. The thing that the allergist is known for is his use of steroids, and you and I use a lot of steroids as anti-inflammatory because it's the ultimate anti-inflammatory. But we've found that it has a lot of side effect. It has an issue with growth in children. It has an issue with the steroid phenomenon, the loss of bone in people that have developed osteoporosis because it suppresses the cells that put bone down. So I think that we always have to achieve a balance, try to do the lowest dose possible to take care of the issue, counsel the patient well on things besides our steroids that will make it better, and hope that they comply with that.
One of the questions we got is a patient says, I've taken many steroids and have a compromised immune system. Should I get the shingles shot?
That's a great question. And of course, there's a recommendation for where in your steroid management, can I get the shingles shot? But there is a place in your management to get the shingles shot, because you sure don't want the shingles, and you probably have some risk, increased risk of getting shingles if you are suppressed by steroids.
We've got a couple other questions we'll jump in here, and one of the questions was, is there an alternative to vaccine? And they were saying, what about thermothol? Not sure what, they're not familiar with that one. Have you heard of thermothol?
No, I haven't.
I guess we can't comment on thermothol.
Oh, what's that? What are the alternatives to vaccines without thimerosal?
Oh, okay.
Thimerosal is
yes.
a additive that they use in order to preserve some of our vaccines. And there are issues with thimerosal, not very common. As we have, iodine used to be something that you commonly saw, because we have it in surgery and betadine and topically, and we see a lot of that. But they do make vaccines that are free of additive. So we have vaccines, I think virtually every one of the vaccines, except maybe pertussis, come in a preparation that is free of any additive.
The interesting thing with the thimerosal, which is the way we say it, or thimerosal, is that the most common where I see allergy, and you may see it as well, is individuals who are wearing contacts. They frequently would buy inexpensive saline solutions that would have poorly prepared thimerosal, and then they'd come into my office with bright red eyes. Well, that was an allergy to the thimerosal. So interesting things with that. Another question they asked about is, what are coagulase negative staphylococcus infections?
Well, you and I both deal with that almost every day, particularly you, because your barrier, the skin, is designed to keep staph out. And once staph gets in, staph has a number of ways that bacteria, it has a very thick wall on it, makes it stealth, kind of a stealth bacteria. It's very good at genetically rearranging itself, so it becomes resistant to antibiotic. So it is a very stealthily bacteria, and therefore very important that your immune system be intact, but probably more important is that your barriers be intact.
One of the things that we hear in the population now today is, I have MRSA, and a lot of people present that as a life-threatening disease, and yet you and I in the regular practice see MRSA all the time. Well, MRSA is a multiply resistant Staph aureus, and so what often comes back is, this is one of these type of staph infections, and the question with this is this really a life-threatening disease? And we see it routinely, and we find, no, it's not a life-threatening disease in the general population. Where we see it as a problem is in the patient in the ICU who's definitely ill and on multiple different products. But do you have suggestions? I know one of the things we suggest is, when you're trying to eradicate the staph, work on the nose, because that's the hidden area.
Exactly, and so we have an ointment that you can purchase that you place inside of your intranasally, and it reduces the amount of staph available on your skin, and reduces the amount that you might transfer to somebody else.
Yeah, so very workable. Another question they had is, are Bell's palsy and Guillain-Barré syndrome related to polio?
No. No. Polio is caused by the virus that attacks the anterior horn cells, and not many have seen polio, but I grew up in a time when polio was active. As a matter of fact, when I was a kid, I got transported to Denver because there was an outbreak in Kansas City, and you know what we used to do then is we quarantine people. Well, people don't even know about quarantine, which is a very effective public health measure for taking care of your immune system. That is, things that we don't have immunity for, you quarantine them. So what they used to do with smallpox before there was smallpox vaccine was to quarantine people, and of course that's how the Native American population lost a lot of people, was the blankets that were sent had smallpox, and their immune systems were not able to manage the smallpox virus.
Interesting things. Well, we have some more questions, but we're going to go on. Studies are being published with the idea that your immune system can impact your health can impact your immune system. Can the mind affect the immune system, or can the immune system affect the mind?
You know, the research on that is coming in, and it looks like the answer is absolutely yes. But exactly what the mechanisms are is a little fuzzy, and exactly what to do about it is less clear. They're coming to see me not to change the immune system, they're coming to me for the depression. Since they may dovetail, it's probably they get caught hand in hand a little bit. It's when people have something bad happening to them and I get them referred to me, I sort of feel like I'm kind of a cheerleader in kind of helping them sort of deal with the bad stuff that's come at them, because most of the time we can't change what that is all that much. Antidepressants may alter the immune system somewhat. We don't. The research on that is very sketchy, and as soon as the drug has been cleared for FDA clearance and it runs out of its patent, no longer do really good research studies get done. So we don't totally know that. There's some of that kind of stuff that's taking place at places like NIH and which is National Institutes of Health and so on and so forth. But it isn't absolutely clear at this time, but there's a lot of data to support that that does interface.
Well, what do you think about stress in the immune system?
Well, this is an area that the NIH has shown a lot of interest in, and recently they published a paper which is available online, as everything is available online these days, that talks about immunity and stress. And they reviewed about 300 articles and rated each of the articles on how well the study was designed. And they came up with actually some fairly specific parameters. The things that they came up with is that different types of stress cause a different type of response in your immune system. For instance, if you have an immediate issue, that is I see something that is stressful for me and it's going to last a short period of time, like being asked a question that you don't know the answer to and you think you should, that kind of thing, that's going to cause an upregulation of your immune system, a positive thing, with not much downside if it doesn't persist. But let's just say that you have something like you were abused as a child or something of this order that you haven't worked through. That upregulation occurred many years ago, but the remainder of it, the depression and that kind of thing, that causes a depression of your immune system. And they've shown that people who are constantly stressed, don't sleep well, chronic fatigue, all of them have a number of issues in their immune system that are downregulated or not working as well.
We've got another question. It seems like shingles is popular tonight. Should I get the shingles shot after I've already had shingles? This is a great question for an immunologist.
Right, and the answer is yes. So do we need to talk it out? Having shingles and what the shingle shot has shown is that when you've received the shingle shot, you have less intense disease and less disease. So, I mean, and you don't want, just like the ad on television, you don't want shingles. When you hate to manage shingles. Oh. I know when I send them to my dermatologist in Aberdeen, he said, what are you sending? I said, oh, this patient with shingles. He's going, oh man, they're hard to manage because they are in so much pain.
Well, and the issue is when they get it, the management requires many, many powerful drugs. It's not cheap, it's not simple, it's a miserable thing. So I agree wholeheartedly, get the shot. Another question, staph infection and thrush, are they the same thing?
No, they're not. Obviously, staph is caused by a bacteria, we called it Staphylococcus, and thrush is caused by yeast. The similarity is that if your immune system isn't functioning properly, both of those organisms are opportunistic, meaning when I get the opportunity, I'm going to attack this guy. So if you're on steroids, if you're on antibiotic, you have a higher risk of both of those organisms, much more the thrush or yeast. And so this whole controversy about antibiotic, we've been talking about this, that's exactly right. I take antibiotic, it makes my acne better, but it's probably going to set me up a little bit for the potential for having yeast, and it depends a little about my T cell function in general.
One of the questions they kind of had a follow-up is, if I get a single shingle shot, do I need to get a booster later?
Good question. We don't know.
Yeah, I thought that's what I don't know either.
That's right.
How does the lymph system help with immunity, and how does it get cancer?
Well, that's another great question.
Wouldn't it be nice if we had that full answer?
Yes,
Yeah.
exactly. Well, the lymph system is kind of another way that we circulate cells, and it has a direct connection to where our immune cells are made in our lymph glands. Remember, they're made in the bone marrow, and then they migrate, and they have a little marker on them that says you stop here, and then you wait to do your job. And the lymph system is the way that they move around. And if that's compromised, you have more infections. So we have people who have you see these people a lot, that get this lymphedema, that they swell, and their skin changes, and they get more infections, and they really have a heck of a time because they can't move that fluid like it should.
Should we take probiotics if we have pemphigoid? I guess I can jump in on that one. Pemphigoid is an autoimmune disease that isn't really related or triggered by anything in the bowel that we're aware of, but probiotics are really not bad for anyone. And so, you know, when you start looking at what's a good thing to do, taking the old unpasteurized yogurt, the various forms, not only is it good for you, it tastes good. So, yeah, I think that's a good idea. Another question, what is a carbuncle? And how is it different from a diabetic ulcer? Your turn. You get to jump in.
Well, fortunately, in the immunology department, we don't have to deal with diabetes very much. We let the endocrinologist and the family practice person. But diabetes is an interesting immunologic disease. That is that we do believe that diabetes, the initial loss of the cells that produce the insulin, is an inflammatory disease guided by T cells. So it really is an immune disease. The downside is that as that immune disease progresses, we lose the insulin. Therefore, our blood sugar rises because we can't manage the blood sugar without the insulin. And that means that our neutrophils, which are very important in taking care of Staphylococcus, don't work right. They're too fat. And they don't do very well. So they don't do what they do best, and that is they just gobble up the bacteria and die. They're fabulous soldiers. They just sacrifice themselves. And they don't do that. When they show a person with high blood sugars, you know, we do that test, what's called a hemoglobin A1C, to see how that's been. When you have a high hemoglobin A1C, your neutrophils aren't doing their job.
Good thing. New question. What is leprosy? Is it seen today, and what can be done with it? Well, that's kind of a derm question, so I'll jump in on that.
That is a good.
We do see leprosy. Leprosy is usually a disease of the southern United States. It's actually fairly common coming up from Mexico. Actually, the leprosy is a bacterial infection. It's fairly difficult to get, so it requires a lot of exposure to the bacterium before you can get it. But it gradually comes in, and as it does so, it tends to affect the immune system. So when you see leprosy, it's a very confusing, very difficult disease because you're not just treating the infectious component, you're also dealing with the immune response. And so in this day and age, yes, we do see leprosy. It more frequently comes from southern United States, but also when we're seeing people coming from the Middle East, we're seeing it from there as well. And in this day and age, very frequently, we'll send these people down to a place called Carville in Louisiana, where there are leprosy specialists. And at that point, they stage the disease. They determine whether this is one where the immune system is working well or not working well, and then they devise the appropriate protocol of antibiotics and anti-inflammatories to treat it. And so it is an eminently treatable disease, but it's a very difficult disease in that it's not just curable very simply. But unlike, you know, back in the early days, it was a disease that people went on and died, and so the only treatment was to isolate them from the population. In this day and age, we can pretty much control the disease and prevent them from going on to other problems. An interesting kind of sidelight in regard to this is when we think about some of the miracles that the good Lord carried out, the Greek word for leprosy and psoriasis are the same thing. And so when we talk about some of the miracles that our good Lord carried out was curing the leper, it may well be that he didn't cure leprosy, he may have cured psoriasis. And one of the things we know about the mind is that when you do good things and the mind works well, diseases improve. And so indeed, it may be that our Lord didn't cure leprosy, he may have cured psoriasis. A new question, and this one we can jump in for you, does West Nile virus affect the joints? And if so, is there something we can do for this?
West Nile is a virus that has become very interesting because the county that I live in has the highest number of cases, sometimes shared with a county in California. So we see a number of West Nile cases. It does affect the joints. It primarily is a disease process of the central nervous system. That's really where it is most devastating. It also, because it causes some immune dysregulation, has a high characteristic of causing fatigue. And we're familiar with these viruses that cause fatigue, like Epstein-Barr virus, which is the monovirus causing fatigue, cytomegalovirus causing fatigue. And so there are some viruses that are, and again, who gets really sick with West Nile? We haven't figured that out because we don't have enough cases, I think, to do that. But we do know about Epstein-Barr, that there is people who have the disease and don't even know it, and then there are people who have the disease and have repeated episodes of the disease and don't manage that Epstein-Barr. We have people who get cold sores. We have people who never get a cold sore. So there is a lot of heredity associated with how your immune system behaves under certain circumstances.
Working with that. You know, one of the kind of crazy things that people have come to me about, and they'll say, well, tell me about these new machines. And I said, well, what do you mean? They said, well, I can buy this machine online that repels mosquitoes. And by golly, there is such a thing. It looks like a cell phone, and it has a kind of a butane cartridge, and apparently puts off some type of a fume that's supposedly offensive to mosquitoes. Have you had any experience or knowledge about that one?
No, I don't. Anything that puts out something that's potentially an irritant always interests me, because obviously I see a lot of upper airway disease. And if your airway already is compromised by smoking, or your job, you're a welder, or you're a farmer and spend a lot of time in moldy grain and that kind of thing, if you're real irritated up there, anything that puts out a fume may further that irritation.
They had a follow-up on the West Nile disease, and that is, are there future side effects from it?
Yes, yeah, they see it there, and they're monitoring those. Our infectious disease folks have been doing an excellent job of monitoring the people post-West Nile and monitoring what those side effects would be. We really don't have a solution for them at this particular time, the people with West Nile.
Here's a question, good one. I'm 90 years old. I've never had whooping cough. Should I still get vaccinated?
That's an excellent question. The answer is yes. That's a question that I had to ask myself, because I had the disease. Should I? And I've had an immunization, because in the military they just immunized everybody. And I still think it's important not to get pertussis. That is a disease that you don't want to get. It is in the population. It is treatable with antibiotic, but it is a very miserable disease and comes on you very quickly. And obviously the cough associated with it is not something that you want to do when you're 60 years old.
We'll be back right after this.
At what age is the color that your skin was meant to be no longer beautiful? Every year, millions of young women try to change the skin they were born with and say they'd die for darker skin. Sadly, some actually do. Melanoma is the second most common cancer in teens and young adults, and one person dies from melanoma every hour. Change your thinking, not your skin. Stop tanning. Learn more at spotskincancer.org. A message from the American Academy of Dermatology.
The word pneumonia was said by Hippocrates himself to have been named by the ancients before him. As old as it is, pneumonia is still a great cause of human suffering, but we now have better weapons to fight it. In a small percentage of cases, especially in the immunocompromised, a bacterial lung infection can follow several days after a common cold. Symptoms then would change from a dry cough into a productive cough, creamy, sometimes rusty sputum, shaking, chills and sweats, and chest pain. It's important to note that antibiotics for the common cold do not prevent a secondary bacterial pneumonia, but antibiotics started after the bacteria grab a hold can be life-saving. It's all about the timing. About 50% of pneumonia is due to the pneumococcus bacteria, now named Streptococcus pneumoniae. Sir William Osler said in the late 1800s that pneumonia is the captain of the men of death. Prior to antibiotics, more than 30% of all those hospitalized for a bacterial infection of the lung would die. With antibiotics, that number dropped precipitously, but still people do die of pneumonia. Mostly they're the very young or the very old, related of course to their undeveloped or weakened immune systems. This July, the New England Journal of Medicine reported since 2000, there's been a huge drop in hospitalizations for pneumonia, with 12,000 fewer deaths every year, especially in those older than 85. What's most amazing is it happened since the advent of routine childhood Streptococcus pneumoniae vaccination, also called Prevnar. Although a similar and effective pneumonia vaccine, Pneumovax, is available and highly recommended for those older than 65 or younger with lung disease or diabetes, it has not become routine. The authors of the study claim that it is the routine vaccination in children that's responsible for most of the reduction of pneumonia in the elderly. They call it herd immunity. Children vaccinated against pneumonia certainly are benefited, but also it profoundly protects the immune deficient adults around them. Well, the take-home message is that it's wise to have children and adults vaccinated against the dreaded strep pneumonia. Indeed, the captain of the men of death has been demoted by antibiotics and vaccinations, both modern developments of science fighting against an ancient disease.
You know, Tom, we've talked about a whole lot of things tonight. Are there some words of wisdom that you'd like to part with?
I have a couple of them. I actually wrote them down because I think they're important enough. The most common question is, what can I do to make my immune system work as well as it possibly can? Or if it's already dysfunctional, what can I do to make it better? And so I think vaccination is very important, as Dr. Holm pointed out. Hand washing is important if you don't overdo it. Don't smoke, exercise, eat right, reduce your stress, take good care of your dental hygiene. It's a place where we have a lot of issues. And we've talked a little bit about probiotic as a possible thing to improve our GI tract. So all of these elements, I think, are going to be very important in making our immune system work better.
Yeah, and it's an interesting world in that it seems like every day we learn a little more, we get a little more sophisticated, and sometimes we get a little more common sense with this. So interesting field. The thing that I find so interesting about medicine is that as we get more educated, dermatology, allergy, immunology, rheumatology, they're all the study of the immune disease. And the more we know about it, the better we are. So it's an interesting world to be.
And I think we don't talk about it much, the science, but you touched on it with leprosy. I think the spiritual part of our lives play a big role in making our immune systems work better by having a center.
Good stuff. Yeah. This brings an end to our show this evening. I sincerely want to thank our studio guest, Dr. Tom Luzier, for helping to answer all the insightful questions from an audience. Actress Annette Funicello, who suffered from the complications of multiple sclerosis, understood well when she said, "When you're young and healthy, It never occurs to you that in a single second, your whole life could change. Until next time, people, stay healthy.
On-Call Television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call, starting its 11th year of opening doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Dakota Care, the Brookings Health System, Dr. Mark Bubak with Dakota Allergy and Asthma, Dakota Dermatology, the South Dakota American College of Physicians, Aberdeen Asthma and Allergy, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.